T790M is a mutation actually in the EGFR gene. And if you think about the EGFR as almost like an antenna that reaches out, some of the drugs that are effective against EGFR lung cancer, like erlotinib, gefitinib, afatinib, what they do is they come and they stick onto that antenna. And T790M is a way that the cancer can adapt or evolve to get around those drugs. And it basically changes the way that the antenna is shaped so that the drugs can no longer attach to it. So even though you're taking the drugs, they're just sort of free floating and they can't actually act on the cancer. So it's a way that the cancer becomes resistant, and it's the most common way that cancers become resistant. 50 to maybe up to 65% of patients that ultimately get resistant to erlotinib, gefitinib, and afatinib will have this mutation. But the exciting thing that's happened over the last couple of years and will be coming hopefully to clinics everywhere in the next few months is T790 specific EGFR drugs. So these are drugs that are very good at treating resistance because the changed shape of the antenna, the new drugs are still able to stick to it. And they can shut down the cancer growth the way that the original drugs did when they were first started by the patients. So the two T790M specific drugs are Clovis, which is also called ruxolitinib or CO1686, and the AZD9291 drug. Both of these T790M specific drugs have been shown to be very active, causing tumor shrinkages in the majority of patients who take them, and being able to control the disease for 8 to 12 months. So this is a big step forward for treating EGFR mutation positive lung cancer.